Protecting the patient in the hospital from getting infections is of paramount importance in patient care. WHO has identified the entrance door in preventing infections is resorting to hand hygiene. Hand hygiene not only prevents infection but also stops the spread of drug resistance and prevents the patient from getting drug-resistant infections. The WHO has identified 5 moments of hand hygiene. The first is before patient contact, which means before examining the patient or performing any procedure on the patient. The second is before any aseptic procedures done for the patient. This may involve changing a dressing, it may involve certain procedures like aspiration of the oral fluids. The third is after exposure to any body fluids or after glove removal. This may be performing simple procedures like doing a blood pressure examination or even a dressing of a patient's wound. The fourth is after contact with the patient. This may mean after a clinical examination or any other procedures performed on the patient. And lastly, after coming into contact with the patient's immediate surroundings. This could mean doing any simple procedures like changing of the bed linen or also after examining the patient. So if a healthcare worker resorts to these 5 moments of hand hygiene and performs the procedure adequately, you can come down on the transmission of hospital or healthcare acquired infections significantly. At Apollo hospitals, we have a policy where all healthcare workers are inducted in the appropriate way of resorting to hand hygiene, the moments of hand hygiene, so that we hold the patient's safety and prevention of infections of utmost importance. At Apollo Hospitals, Chennai, we follow the 2009 WHO recommendations on hand hygiene when and how. You take a cup full of the alcohol rub. Ensure that you rub the alcohol thoroughly in your palms. The next step involves interlacing the fingers of both the hands to clean the hands, and then you have to interlace the fingers again so that the palms face each other. This is followed by interlocking of the fingers and ensuring that all your fingers are thoroughly cleaned. Then you resort to rotational movement of the hands of both thumbs to clean the thumbs, and finally you rub the tips of the fingers over both palms to clean the pulps of the fingers, and then you let it dry. The whole procedure should last about 20 to 30 seconds, and then you are safe to approach the patients without the fear of transmitting infections. At Apollo hospitals, infection control is everybody's business, and we take pride in keeping our patients safe and infection free.